Support for Radio Friends comes from Columbia Healthy Smiles, the dental office of husband and wife team Dr. Batson and Dr. Abe, offering comprehensive and customized care to patients of all ages. Learn more by calling 573-721-9039 or online at www.columbiahealthysmiles.com. Good morning and welcome to Radio Friends on Wednesday, June the 22nd. Good to have you with us. I've got two doctors today, two experts, and we're going to talk a little bit about asthma. Dr. Satish Kalanjeri and Dr. Jeremy Johnson, both from the VA hospital. Good to have you here.
Thank you, Paul.
Last time, Jeremy, we were talking about sleep apnea, and you had a lot of interesting information there. By the way, you cut your hair, too. Walked in today. You got a haircut.
Yep.
What happened there?
Well, this is how I always wore my hair, and I just kind of grown my hair during the COVID pandemic when we couldn't go to the barbershops. Is how it started, and it just took off from there.
In case you hadn't seen him on video, he had hair down to his shoulders. Now,
he's broken many hearts at the VA.
Is that right? Now, today, our topic is dealing with asthma, and you told me that 25 million people in the United States are dealing with asthma. And I am one of those 25 million people. I've had asthma for a long time. I had been using, my doctor had prescribed the albuterol rescue inhaler, which works wonderful. Before that, I used to use, years and years ago, I was using Primatene Mist. But then people said, that's not really good for you to use it long term like that. So he prescribed albuterol. That was good, but the asthma was advancing, getting worse. Then he put me on a medication that's called Flovent. Is that the correct pronunciation?
Flovent.
Flovent.
The generic name.
It's kind of like a miracle drug.
Fluticasone.
Yeah. So what is that doing? I mean, it works. It has kept the asthma intact. I've had no asthma attacks. I've not had to use the albuterol. What is Flovent, and is it something that people with asthma can stay on?
Yeah, that's a great question. So this is what we would refer to as a controlling medication. So it's actually an inhaled corticosteroid. So it provides anti-inflammation. And so if we think about asthma being a disease of narrowing of the airways or swelling of the airways, tight airways, so if we can treat the inflammation of the airways with a controlling medicine called fluticasone, inhaled corticosteroid, then that can relax the airways and improve the inflammation so that we have a bigger opening of the airways, if you will, to help control our symptoms. And so this is remarkable.
No, I'm not trying to sell this product, but I'll tell you, it took about a month for it to work, where I do 2 inhalations in the morning and inhale twice in the evening, 12 hours apart. And I remember my doctor saying, now, don't give up on it. It's not a rescue inhaler. It's not something that is going to work immediately. And when I was reading all the information about it, it said it could take anywhere from 3 to 4 to 5 to 6 weeks for you to notice. Well, my symptoms started getting better within a couple of weeks, and it's been months now, and I've had no symptoms at all of asthma. Is this what most people can expect?
As Dr. Johnson mentioned, asthma is primarily a condition where there's inflammation in the breathing tubes of the lungs, primarily the smaller breathing tubes, and that leads to narrowing, which means some of these medications will have to reduce the inflammation, and that takes time. That's a healing process. And therefore, to your point, most patients do have to expect a few weeks to pass by before they see any kind of improvement.
Now, you said the healing process. Does that mean that I am cured of asthma?
Well, that's one of the most interesting questions I've come across about asthma. If you look at the literature and if you ask, the societies that deal with asthma cannot be cured. It is true that some kids who have asthma outgrow or grow out of asthma, so to say, Some people grow out of asthma and it comes back years later, and some never do. So the goal of treatment here is not to cure asthma, because there is no cure. But unlike many other conditions, asthma symptoms can be kept under tight control with these medications. And most of these medications have little side effects over time, and with some simple measures, one can take the medications and lead a perfectly normal life without symptoms.
Yeah, I'll tell you, it has worked for me. I am so thankful that my doctor did prescribe this. Are there things that you can do to stay away from the medication so that you don't have asthma attacks? What are some of the precautions people can take?
Yeah, so I think every person is different, and so to your last question about can everybody expect this dramatic response? Not everybody can, and so some folks have worse asthma and they're more difficult to control, and we have new novel things that are emerging in different treatments other than what you've described, the inhaled corticosteroid. There's other new novel treatments, but everybody is different. We have to know what our triggers are. So
right.
That's the thing. So how do you control your asthma, like you mentioned, without medication? So you have to know what your triggers are. So some people it may be grass, some people it may be pollens, some people it may be cigarette smoke, some people it may be other toxic fumes. So you have to know, every person has to know what triggers their asthma. It may be exercise, it may be sleep. Everybody has different triggers. And so we have to educate our patient what, they have to know also to discover what their triggers are so that they can avoid those things.
Yeah,
so
and if you can't avoid them, then the next best thing is controlling the asthma with the medication.
I think if there is a clear trigger, you'll have to either avoid the trigger or try and mitigate exposure to the trigger or minimize exposure to trigger. And Dr. Johnson and I were chatting outside when people have pets, and pet dander, cat or dog dander can be a trigger for some. And, as a dog lover yourself, as
right.
a dog lover myself, and Dr. Johnson.
That's non-negotiable.
That's not negotiable.
Right.
And then the question comes as, you cannot avoid this trigger. How can you mitigate exposure? Then the question is, how much time do the pets stay indoors? How much time do they stay outdoors? Who cleans up the dander? And then do they sleep with you on the bed? Is it possible to have them in their pen or in the crate at night? Or so the question is for each person, how much of this is negotiable? How much of the trigger you can avoid? So then it boils down to those kind of questions.
Right. If you want more information, people can contact you at the VA hospital.
Yes. 573-814-6000 and extension 53363. And those that are not veterans who don't go to the VA hospital can contact the University Hospital or Boone Hospital. We've got some excellent pulmonologists there as well.
Thank you so much, doctors. I appreciate you coming by. Please come back again.
Thank you.
Thank you.
Okay, we're out of time for today. Pepper P, Missouri.edu. Bye-bye.